Hello and welcome to the Fineprint. Our multimedia team recently visited Keat Hong Community Club on Sunday, 30th November, to cover a men's health event. The event featured Dr Hamid Razak, Member of Parliament for Jurong Spring, and Madam Rahayu Mahzam, Minister of Digital Development and Health. We've gathered the most important sound bites that are relevant to you, and we've also included interviews with participants sharing their experiences from the event. Stay tuned as we bring you highlights from this meaningful gathering.
A lot of us keep our fears on mental health because we feel that someone else is going to judge us, that it's a sign of weakness, right? That I will be less of a man if I tell someone else that I'm stressed or I'm sad or I'm feeling a certain way, right? We all need to have that person that we would trust, that you can speak freely to just for the decompression. Of course, now you have AI chat boxes that you can chat to on mindline.sg. You have many games that you can play to distress. But I just want to bring ourselves back. We are humans with emotions, and I think the human to human interaction helps tremendously in regulating and managing our emotions. Yes, technology definitely is helpful, I would say. But do not forget that it sometimes takes another person to understand what we're feeling, and that's very important.
In Singapore, as a system, MOH, when we actually do subsidies and arrange for healthcare financing, we always have to look at what's medically indicated and what is cost effective, because you're talking about large populations. So we study and assess what is meaningful for the community and society. Of course, a lot of things are good. But if we say yes to everything, it is not something that's sustainable for the healthcare system. So there is actually an expert committee that will actually assess, based on the community, what is the sort of prevalence, what is the public health risks, what are the cost effectiveness of something. Because something may be very good but also very expensive, then it doesn't make sense for us to say we subsidize. So whatever that is in the list now, the expert committee has gone through, assessed that it is something important, but it's also cost effective, and it's something that we can then give to everyone. Because when you give subsidies, it's not just to one person, but depending on the prevalence, depending on the condition, not everybody may need it. So we do make a judgment call as to what gets into the list.
Hi, I'm Jovan, writer and multimedia producer for the Fineprint. And today we have these four gentlemen from Team BA from Ngee Ann Polytechnic that actually came and joined the men's health event at Keat Hong CC over here. So maybe each of you can introduce yourself and just start with a key takeaway that you guys got from this event.
Hi, I'm Amos, year one business studies student, and I think one key takeaway that I had from this is that mental health, there are resources for it, and that even though in Singapore as a whole, like as a region itself, right, generally have a lot of stigmatizations. There are actually I after today I learned that there's a lot more resources to help like men's like mental well being also.
I'm Derek. I'm from year two accountancy. And one key takeaway is that I learned that preventive measures are more important than facing the issue when it happens. So I feel like preventive measures is the most important part for mental wellness and physical health.
Hi, I'm Caleb. I'm also from year two accountancy. I'll say that one key takeaway I took was that um, there are resources available and that we should speak up whenever we feel that we are facing challenges, because there are people around to support you.
Hi, I'm Jun Tan from year two accountancy. And I think to sum up whatever all three of them have said is that you don't have to do things alone. You can share whatever things you want to share, like any mental issues, mental health, anything you can just share with your friends or a close one.
Okay, so since four of you are from Ngee Ann Polytechnic, so maybe you can think of some interesting policies that can be implemented to, um, help you guys manage your health better, be it mental or physical, in maybe Ngee Ann and maybe in Singapore also.
I think for Ngee Ann, a lot more of this like workshops, like maybe not say it doesn't have to be outside. Maybe like even in school, right? We can like host like similar workshop or events that helps to talk about and spread awareness about mental health. And this can be done through like a lot of the volunteering CCAs also. Yeah.
I think I agree with Amos on the fact that we need more workshops in school, like own schoolmates. So maybe some of the clubs can carry this out. And I think it's better to make this compulsory and part of our curriculum. Yeah.
I agree with what the earlier two said, but I also feel that more awareness can be done. I'll say that we already have a few sessions in school, like during pastoral care sessions, where sometimes our mentors will go through like talks about mental health and stuff like that. But yeah, I do agree with them in saying that there should be more compulsory sessions that we should attend as a whole, instead of like, if you want to come, then come. Yeah, there should be more compulsory sessions.
Oh, okay, so yeah, so actually I agree with all of them that you have to make it compulsory. But that being said, there's that you cannot. Yeah, we say it's compulsory, but people may still not come. So to encourage people to join, we need to really like show them what the issue really is, or give them a teaser during our pastoral care and mentorship sessions.
Okay, thank you all four gentlemen for the really insightful feedback, and I think that's it for the interview today. Thank you very much.
As we've seen in the video, men's health in Singapore is not just about who qualifies for subsidies, but about who feels safe enough to say, I'm not okay. Yes, digital tools and expert committees can stretch every healthcare dollar, but only human to human trust turns policy into prevention. You've heard from leaders, doctors, and students. Now the question returns to you. What will it take for your circle of men to stop suffering in silence? Now, do consider liking and subscribing if you enjoyed our coverage so we can continue to uncover perspectives that deserve to be heard. With that, I thank you very much for tuning into the Fine Print. We hope to catch you on the next episode.